My name is Dr. Tim. As most of you will know, I'm a chiropractor, and chiropractic is all about getting the most from your life. I'd like to introduce you tonight to the concept of gravitational biology. Oh my God, what on earth is that? Well, basically, we live in gravity, and gravity, we move through gravity, and gravity, if we are aligned and we exercise and everything is in order, then gravity makes us strong and gives us strong joints and strong bones, and everything is good. But if we are out of alignment in gravity or out of balance, then that quite substantial gravitational force will gradually destroy us. And that's indeed what happens to many of our discs. I can hear somebody is trying to use their... Can I ask everybody to mute? I'm just going to try and mute everybody. Okay. So moving on. Hopefully most of you want the same from me, from your life. You want a long life. You want to avoid disease and degeneration, of course. We want to be energetic and vital our whole lives. And of course we want to be happy. And to be happy, we have to be comfortable in our own body. We want to be pain-free. And if we can have a nice pain-free, energetic life, it's going to be a good life. But unfortunately, many people don't enjoy that. And so tonight we're going to learn how our spinal discs are designed to help us move in all directions. And it's these discs that enable us to move through life without pain. Unfortunately, many of us do not get to enjoy during our later years that important time with our families. I believe passionately that our families are our magnificent purpose in life. This is what we work so hard for. And I know, because I'm on the front line with people suffering from pain, that many people, unfortunately, don't get to spend the quality time with their family late on because they are suffering. And unfortunately, people become victims and their families end up having to look after them, which is not a good thing. And one of the main culprits is our spinal discs. We do not want to be this. We do not want this to represent our future. But unfortunately, the reality for many people, people do tend to suffer a lot. So after today, we're not going to suffer. We're going to look after our discs. Unfortunately, the sedentary life that we live in is very, very pervasive. I'm sure many of you right now are sitting at your computer, but unfortunately, I'm sure many of you have been sitting at your computers all day. Well, this is not... Somebody is making some noise. I've tried to mute everybody, but unfortunately, if you're not muted, please go ahead and try and mute yourself. I'm trying to mute everybody. Yeah, the sedentary life of ours is not good. It is a fact with our body that we move it or we lose it. And this applies extremely accurately to our spinal discs. They are designed to move, and we're going to see how our discs work today. When we see the enormity of the problem that people suffer from this disc thing, we see it in the stats. Back pain, especially disc problems, is the leading cause of disability worldwide. It's one of the most common reasons people miss work, and it's a fact that 80%, that's 4 out of 5 of us, will experience severe back pain at some time in our lives. In the last few years, worldwide, it's estimated that people living with disability caused with low back pain has increased by 54% between 1990 and 2015. That's the last 25 years, it's gone up by over 50%. Now, because I know that we are sitting more and more in this world, I know that it's probably going to go by another 50% over the next 25 years. And there's a huge, massive personal cost here. Today, as a chiropractor, I want to help us be more proactive And if there's anything that needs to be looked after in our life, it's our discs. Unfortunately, our bodies didn't come with an instruction manual. Unfortunately, for many of us, we haven't been taught how to look after our discs. So that's the purpose of today. Too many people are suffering, end up going for terrible spinal surgeries, all manner of things, laminectomies and microdiscectomies, fusion surgeries, and when there's so much pain, nerve ablation. These are all terrible, terrible things that the medical doctors have to do when our discs get so bad. So we really don't want to go there. Let's go back to that slide. Our spine and our discs form an integral part of our anatomy. If you just look at that picture there, you can see clearly that our brain communicates with our body through our spine, through our central nervous system. Our spine is our main supporting structure, of course it is. But look what comes out. The nervous system is intimately related to our spine. You can see there the spinal cord splits off. All those nerves go to all our vital organs. And when we suffer problems in the spine, it very often relates to problems in the organs. The alignment, the function, and health of our spine will very much determine how our nerves work in the future. And it's a fact that the health of our spine will very, very much determine how we age. This is the focus of chiropractic. This is what we're doing in our clinics all day, every day. We are realigning our spine. We're getting our spine moving so those vital, vital nerves can work uninterrupted. This is the importance. Today is not going to be a long talk. I really want to talk about the very, very most important aspects so that you can focus on them. The first thing to think about is that your spine consists of 24 vertebrae. There they are, right there, all stacked on top of each other, like little Lego blocks, one on top of the other. They need to be balanced. They need to be in alignment. You've got 4 lumbar vertebrae. On top of that, you've got 12 thoracic vertebrae. Associated with those, you have all the ribs that encase our thoracic cage, encasing all our organs. Above that, we have our 7 cervical vertebrae. Now you'll notice that what have we got there? We've got 3 curves. Our low back or our lumbar area consists of a curve. It's called a lordosis. And you see the curve goes one way and then it leads into the thoracic curve, which goes the other way. All these curves, they want to be sufficient enough to create a shock absorber, because that's what the curves are for. Obviously, from front, the spine needs to be straight to be strong, but from the side, we vitally need these curves. Moving up the spine, we move to the neck. We have 7 vertical vertebrae. And that again forms a vital curve, and we call that curve our curve of life, the arc of life. Between each of these vertebrae, all 24, is a spinal disc. These are called intervertebral discs. They sit in between the discs, and they do vital roles. So we're going to learn now about the functions of these discs, because this is what we're talking about today. Keeping all those vertebrae apart are little cushions. These are the spinal discs. They are cushions or shock absorbers, if you like. What do? Well, they vitally maintain the space between the vertebrae. They maintain space. If there's no space between the vertebrae, we're not going to be able to move. So if you think about the bones, the solid bits of our spine, they can't bend by themselves. They are strong and solid. They're part of the structure. They're strong. They're solid. There's no movement in the bones. All the movement in our life is in our discs. So we've got to keep them moving. What else do these vital discs do? They protect the central canal. You'll notice from that illustration on the left that there's a few nerves there. You see the little nerves branching off. They are the peripheral nerves that branch off from the spinal cord. This is your central nervous system that connects your brain inside your skull. Your spinal cord runs down the middle of all the vertebra, and it runs just behind the discs. So those discs, they keep the bones apart, and they protect this central canal that encases our very, very vital spinal cord. Okay, in a moment we're going to see what happens when we develop problems with these discs, and then it starts to press on the spinal cord. Not a good thing. Of course, these discs have got to last a lifetime. We know that if we have good function, good movement, good alignment, that these discs will last over 100 years. There's plenty of people, centurions, that are moving through life without too much pain. This is what's possible for all of us. But here in Singapore, already many of us are starting to suffer, and we're only in our 20s or 30s or 40s because we are allowing our spine to stiffen up. Something that we really need to do is prevent the stiffening that causes premature aging. So what about the properties of these discs? Well, of course, we need them to be strong. What are they doing? They're holding the bone up that's directly above. You know, as we get older, discs tend to get a bit thinner. That's where much of the loss of height comes as we age. We want our discs to remain strong and resilient, but of course they've got to be flexible. Now, how do they stay strong and resilient? Well, they have a property called turgidity. What is turgidity? Well, it's the internal fluid pressure. So inside the discs, what we're going to see in a moment is we're going to see that the discs will bring in the blood from the outside, and then that creates fluid pressure that holds up the bone above. Okay, so let's have a look at that. So here we see the intervertebral discs from the side between the two bones. So on the left, this is seen from the side. You see the blue disc, it's holding the bone up that's above it. Now, it's very important that this disc retains its fluid pressure, because if there's a lot of force, a lot of weight above it, then the discs can start to squish. So what we need is these discs to stay full of fluid, and we do this with movement, as we'll see in a moment. So let's have a look at this, what constitute the discs. Well, there's two main parts. I really want you to try and remember this, because I think it's very, very important. The two main parts are we've got the nucleus pulposus, which is the dark blue bit in the middle. Think of that as a gel or like a sac in the middle of the disc. Think that it has a consistency, something like toothpaste, and it's all encased. Now, this is in the middle, and it allows us to move. It forms a pivot point that we can move over. It's very, very important that this nucleus, the center of the disc, is in the middle. And that's why it's so, so very important that our discs, all our discs and all our bones that form our spine stay in alignment. If we move to the side, that nucleus can get pushed to the side, and that's when we can start to get some problems. Now, surrounding that nucleus is we have something called the annulus fibrosus. Now, this is lots of layers of intersecting, like this. You see my hands there? They are intersecting fibers. It forms a mesh. And now all these fibers are orientated in different directions. So that allows us to move, but retain strength in all the directions. Some of these fibers will resist the problems, the forces of torsion when we twist. Some will protect us when we bend to the side, some when we bend to the front. Okay, now these are very, very important, that they encase the nucleus, and the properties of these fibers as we age can be maintained strong and supportive if we look after our spine. Okay, so we're going to talk about strategies how to maintain the strength of these important things. There you see the importance in the yellow, the very important spinal nerve root and the spinal cord. You notice how it's just behind the disc. If that disc fails in any way, look how close the nerves are to the disc. Okay, we do not want our discs to move backwards, because that could be a disaster. Obviously, life is about movement. We move through life. So of course, our muscles and our nerve system, they all work together. And our discs, remember, it's the discs that enable us to move. Okay, so now what we're going to talk about is we're going to talk about what happens if the discs start to go wrong. So let's think about the most common spinal disc problems, because if we understand how they come about, then we can make sure they don't happen to us. So the very first thing to remember, and I think this is so fundamental, I believe it's probably the most important thing to remember. I know it seems counterintuitive, and I do believe that our spine actually perhaps even has a design flaw. You see, we were designed for a very, very different lifestyle. See, our discs have a very, very poor blood supply unless we are constantly in movement. It's movement, constant movement, that keeps our blood moving in and out of our discs. So there you see somebody skipping up and down. This movement, this constant rhythmic movement is going to suck in the blood and the nutrition and the oxygen. Let's see how it works. So there you see an illustration. There you see the vital discs rely on movement to create a pumping action. You see, what you see in the illustration on the left is you see the vertebral blood vessels in the red. They actually go to the bone either side of the discs. And it's movement that causes a pumping action that actually draws in the blood into the discs. If you see at the bottom there, it says the avascular intervertebral discs. That means that the discs do not have a blood supply. They are avascular. The discs are supplied from the surrounding tissues by the vertebral blood vessels. And it's a fact that these nutrients, they have to diffuse from the outside to the inside. And it's movement that draws this nutrition, this vital nutrition into the discs. And then it also pumps out the waste products. So any movement that in our spine is constantly drawing this vital nutrition into our discs. Obviously, that leads us to problems in our life, because now we tend to move much less. I heard it said that in this life that we live today, we we move something like a 200th of the amount of movement that we used to in the old days. So our predecessors, going back centuries, used to move 200 times more. And if you think about how much you've moved today, many of you woke up, and you moved straight to somewhere to sit, to take a breakfast. You sat somewhere on your way to work. You sat all day maybe at your desk. You sat on the MRT coming home. Now you're sitting now. There's not a lot of movement there. We've got to think in terms of movement and life. The two, they are so closely associated. So this is what happens when we're not moving, and when our spine starts to develop poor alignments. We start to develop problems. So I'd like you to look at this illustration on the right. You can see the topmost joint, you see a normal disc. You see how it's quite fat? It's keeping the bones apart, it's maintaining a nice big hole for the nerve to pass through. But if you look at the disc one down, you can see already it's getting a little bit thinner. So of course the person is losing a little bit of height, right? But what's happening? Well, not enough movement. So there's not enough fluid coming in. So we're starting to get a little bit of desiccation. Yeah, desiccation. The disc is actually starting to dry out and it's starting to squish. If this goes any further, then the disc is going to start bulging. Now, if you're leaning to the left, it might bulge to the right. If you're leaning forward, then the weight of your body is going to push that disc backwards. And you can start to get a bulging disc into that hole where those important nerves are, remember? So then we started to get a bulging disc, which is pressing on nerves. Not good. If this gets any worse, then we can get this terrible situation where we actually get a pronated or a herniated disc. And this is where that nucleus, remember the nucleus in the middle of the disc? Yeah, that can push through the annulus, that fibrous outer layer of the disc, and it can push through right into the area where the nerves are. Now this is, you've heard the expression slip disc. This is what's happening there. We've got a herniated disc. Okay, now if this is allowed to continue, if the problem is not so bad that we've gone to hospital already, then the disc will continue to thin, and you'll notice how the hole for the nerve is getting smaller and smaller and smaller. Now you'll also notice that around these thinning discs, we're now starting at the bottom to get changes in the bone. We're starting to get the growth of osteophytes and degeneration of the, they're called the end plates, where the bones meet the discs. These are degenerating. And now, unfortunately, we've got sharp bits of bones growing backwards and into that space where the nerves are. It's all getting very, very much more serious. And again, that the vital holes for the nerves are getting smaller and smaller and smaller. So, you know, what has caused that? And this is something that we see all day, every day in our clinics. People come in and, you know, yesterday they feel good, now they feel terrible. They've got pain running down the leg, sciatic pain, suddenly a disc that had been degenerating. And it could have taken 10 or 20 years for it to slowly happen. Suddenly we get some kind of failure. Some people report as they were doing something fairly innocuous. They might be lifting something out of the trunk of the car. They may be leaning down to do their shoelaces, or perhaps even leaning forward to brush their teeth. Something as small as that. That additional pressure leaning forward, suddenly you get failure. Boom, the disc fails, and now we've got a real problem. So it's that gradual deterioration that very rarely happens unless you have macro trauma, unless you're hit by a taxi or fall down the stairs or something. This generally is something that builds up over the years. So let's have a look at it a little bit more. So here you can see what is happening with postural degeneration. What you're seeing here is something that we see very, very often. It's getting increasingly common in this world, unfortunately. This is what happens with forward head posture, you know, forward head posture, which is something I talk about an awful lot. In fact, this is what spurred me to write my book. As the head moves forward and the neck straightens, we see that the weight of the head is moving forward onto the delicate discs. Here we see the discs starting to thin. We start to see them being pushed backwards into that central canal. And now we have something called spinal stenosis, which is very, very serious, because you can see the disc is pushing backwards and it's squishing the spinal cord. Obviously, that's not very good. Now, this is an illustration. And when you see it in real life, it can look quite scary. And this is something that I see, unfortunately, quite a lot. This is actually an MRI of somebody whose head has come forward. You see they're looking to the left, their head has gone forward to the left, and we've lost the curve. The weight has gone onto the discs. And if you look at the 1, 2, 3, the fourth disc down, you see all the bad discs have turned black because they are desiccating, they're drying out. You see the discs at the bottom of the neck aren't so bad. They're still fairly white. They're light in color, but the ones above have gone black. They're desiccating. These are the bad discs. But unfortunately, the one between C2, 3, 4, the one between C5 and C6, in the green box there, the disc has suddenly failed. So this is a slipped disc, and you see how it's gone backwards into the spinal cord. This is a very, very serious situation. And this is where this is not, hopefully not too late, chiropractically speaking. We can still hopefully work with this person. But if it gets any more serious, then you're definitely looking at surgical intervention. And remember what they do? They will tend to cut something out to let the spinal cord get round the obstruction. They're not going to fix the cause of the problem, which is a loss of alignment, stiffening, forward head. This is something that really needs to be corrected more functionally. And we see this in the low back as well. Here you see a slip disc at the bottom of the low back. You see the white discs are the good ones, but then you've got two bad discs at the bottom which have desiccated. They've gone black. The most common level for a slip disc is between L5, which is the bottom vertebrae you see there, and the sacrum. And you can see there, we now have got a slip disc. The very most bottom disc has failed. It's gone through structural collapse, if you like. The nucleus has pushed through the fibrous exterior, and we've now got cord compression. We've got a very serious situation. Again, chiropractically, it's likely that we can help with the situation. And let's talk a little bit about surgical intervention. When we are starting to get these problems, it's tempting to go to the medical doctors. And of course, sometimes we need to. If the pain's bad enough, we do need some pain medication. But it's always better, always better if we can do things naturally. We should always look for non-invasive treatment before we look surgically. I have a friend in London who has been walking with a walking stick for many years. She's only 50, and she's been walking with a walking stick probably now for 20 years due to failed surgery syndrome. She had a slip disc. She went for surgery. The outcome was not as good as she hoped, and she's had a terrible problem, and she's been in court virtually ever since. They never ever suggested that she tried non-invasive activity first. So if you go to an orthopedic surgeon with a spinal problem, you're probably going to be pushed down the route towards surgery. So be aware. In our clinic, when people come with their pain, even if it's sciatic pain, even if we know it's a disc problem, more than 99% of cases we are able to save from surgery. Okay, our success rate is really good. Now, obviously, the success rate will drop the longer you leave it and the more degeneration. So my advice always is to try and seek for non-invasive improvement through chiropractic at your earliest possible opportunity. So let's talk about a few tips for taking care of these discs. I always talk a lot about posture and alignment. So to do this, looking after our alignment, this may of course include exercises and changing position frequently during the day. Using good spinal mechanics when we're lifting, even when we're leaning forward, brushing our teeth, or doing our shoelaces, we can engage our abs. So that core, our core musculature, we can engage that when we're leaning forward. That will help protect our spine. During the evening, when we're in bed, sleeping on a firm, supportive mattress is what we will always recommend. You do not want a very a sagging mattress. You don't want your spine to sag. It's called hammocking. It's going to put a lot of pressure on your ligaments. You're going to wake up in the morning very stiff, but it's also putting a lot of strain on the spinal discs. And remember, it's pushing that nucleus to the side of the disc, which we really don't want. Maintaining a healthy weight, obviously our weight goes through our spine, through our discs. People who drop a few pounds, they quite often they report a lot of relief when it comes to spinal pain. So, you know, try and look after your weight. I'm going to talk a little bit about eating nutritiously. We really want to keep the inflammation in our body to a minimum. What we've been talking about with spinal problems and problems with discs, this is arthritis. Now, medical words are descriptive. The word arthritis means itis means inflammation, and arthro means joint. So we're talking about an inflammatory situation. So anything that can reduce inflammation is going to be a good thing. Remember, I talk a lot about bringing fluid, bringing the blood. Remember, the blood is the carrier system that moves all the nutrition and the blood and oxygen around the body. We need to drink a lot of water during the day. Okay, so as I tell our clients, as we're coming into and we for adjustments and we improve the movement of the spine, we want to drink plenty of water. We want plenty of water in our blood so we can find its way into our discs. We really don't want to become dehydrated, because the body will always protect the brain, and it'll start sucking the fluid out of other parts of our body, including our discs, to maintain the nutrition of the brain. Okay, so drink lots of water during the day. A couple of no-nos: drinking alcohol, drinking coffee as well. Most of us know that these are dehydrating. So drinking too much alcohol will certainly lead to disc problems if we're not careful. There's another one on the bottom there, which is a no-brainer. So if you are a smoker, please, you need to quit. If you are a non-smoker, never, ever, ever start. It's the worst. It's the one worst thing you can possibly do for your body. People who smoke throughout their lives, they tend to have terrible spines, and it because your body basically becomes toxic, and it's not getting the nutrition. It's degenerating in so many ways. Okay, never ever smoke. So, as a chiropractor, I talk a lot about structure and function. You see this lady, this is good posture. Let's just remind ourselves what good posture looks like. If we are going to have a healthy spine, we need to have good posture, okay? That's all our centers of mass stacked on top of each other. You see the lady on the left, the head is on the shoulders, and the shoulders are above the pelvis is right above the ankle, okay? Everything is straight. There's a straight line. It's called the central axis line. If you maintain that, you're more likely to have healthy discs. You've got to avoid developing this forward head posture. Why do I talk about posture? Well, yeah, the chimney on the right is a chimney that I built in my previous life as an engineer. And, you know, we are talking about engineering, structure and function. It needs things to be in the right place. We need to have the right alignment. Okay, I cannot stress this enough. Obviously, if we are going to look after our spine, if we're going to look after our lives, our health, we need to be proactive in life. And so we want to practice prevention. What can we do? Obviously, move more during the day. So if you're sitting during the day, try and stand up more. Move around, go and get glasses of water. Maybe move your spine, arch your back, and as I sit up here. So the lady on the right in the illustration, what she's done very, very simply, she's fixed her ergonomics. She's lifted her laptop up, she's put them on a pile of books perhaps, she's using Bluetooth. So that's enabled her to sit nice and straight. So if you're slouching right now, I invite you to do something. And this is going to take the pressure off the discs in your spine. So I want you to feel what it feels like. So I'd like you to go ahead, lift your sternum. That's your breastbone right there. Lift it, okay? What happened is that you tipped your head back on your shoulders. You can now pull your head back on your shoulders. Why not open your shoulders? You'll notice you've got a curve in the low back. That's open the discs, right? When we've got a curve in the low back, the discs have opened, that's sucked in some fluid, that's good. So maybe you can pop something behind your low back now to support that curve, okay? This is prevention, this is good posture, this is your default position. Now, I'm just going to go back one. Let's just think about the alignment there. You see how the alignment should be straight. So somebody taught me something a long, long time ago. If you look around your room or look out the window, you'll see many, many vertical lines. I'm looking at outside my window and I can see a column on the side of the house. I can see the next door house. I can see the end of the wall. These are all straight lines. And I spent a time, every time I saw a straight line, a straight vertical line, I corrected my posture. And this is something that somebody taught me many, many years ago, and it became subconscious. So as I'm now moving through my life, subconsciously, when there is a straight line, a straight vertical line, I correct my posture. Try it. It's a trick. If you can get that to work for you, it's really powerful. Okay, just try it for yourself. So moving on. If there's one thing that I really want to stress today, it's move. Move, 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 move. I heard it said a million times, the stiffening of age. People age and stiffen. Well, please listen to me now. You don't age and then stiffen. What happens is that you stop moving so much, so you stiffen. And then after stiffening, you age more rapidly. Okay? So think about it. Keep moving. It's the basis of slowing down aging. One of the journals that I read all the time is called Spine. It's peer reviewed. It's one of the leading journals. In 2015, they put it out there that specific loading through exercise can impart healing and regeneration to the intervertebral discs. What does that mean? Yes, the spine can start to recover if we start to move, if we start to exercise. But remember, as long as it has the right alignment. So let's just think a little bit about nutrition, because people with bad diets will inevitably suffer from spinal stiffening and disc problems. So I would like you to consider, if you're not moving in this direction, to consider a plant-based paleo diet. What does that mean? Well, paleo means that the diet is based on our genetics, what our ancestors had. You know, our ancestors did not eat processed food. It did not eat all what we call the sad American diet. You know, all these preservatives. These things are bad for us. They make us acidic, alkaline. We want to eat food that's produced naturally. These are whole foods. These are the foods that will help us heal. So mostly plant, and then with a bit of protein. That protein is okay if it's meat. It's okay if it's fish. It's okay if it's eggs. But I would urge you to go towards organic, grass-fed. Try not to go for hormones and all that stuff. Try and eat less meat perhaps, but make it organic. That would be my advice. But very much it wants to be plant-based. We want an anti-inflammatory diet, okay? This is what we're after. please try and avoid. These are the foods that were prepared for some company with profit in mind, certainly not with the health and your vitality in mind. We should be avoiding sugary foods, poor quality vegetable oils, refined grains. These are disasters. Not natural dairy, so dairy that contains hormones, that's been homogenized, and that's not, that actually makes us acidic, not good. Too much red meat is recognized as being bad for us. Processed meat is bad. Obviously, food, look at that food on the top left. If it's got colors, if it looks like it came out of a factory, it probably is really bad for you. So try not to put that on your plate. So I really would urge you to start to think in terms of health span. This is what we do in chiropractic. We are trying to increase not so much our lifespan, but our health span. If we look after our health span, if we increase our healthy years, we'll get more quality years with our loved ones. This, incidentally, will probably increase our lifespan. Yes, aging, if you think of it as a disease process, it is very much curable. And how do we do that? We keep things as natural as possible. We look after the balance in our body in all the pillars of health. Obviously, alignment, movement, nutrition, healthy sleep, all these things are so important. Okay, so basically what I'm talking about is adopting a chiropractic lifestyle. Okay, so what I've been talking about today is mostly the discs inside your spine. If there's anything I can help you on, then please, you can just pop it in the chat right now. I'm here to answer any questions. If not, please engage with us on our social media. If we can be of help to anybody out there, if anybody you know has disc problems, then go ahead, help them find their way to one of our 5 clinics. There's a QR code there. Just take a picture of that. That'll help help people find their way to our clinics so they can enjoy a discounted first visit. Okay, I've a whole lot of information there. What I wanted to do is just make sure the basics. So let's just remind ourselves of those basics one last time. Alignment is vital. Movement is vital. Why is movement vital? Because it's the only way we get nutrition into our discs. Okay, so I'd like to thank you for staying with me today. Again, this is going on our YouTube channel, so you will be able to share it. You will be able to pass on this vital information. So thank you very much for staying with me. My name is Dr. Tim Errington. This comes to you from Total Health Chiropractic. Have a wonderful evening. And again, please look after your spines. Okay? Thank you so much for you. Have a great evening. Bye-bye.